Thanks, Lucy. Della's also on leave this week, which is why I'm giving her a normal roundup of campaigning over the last month. As always, massive thank you for all the campaigning you've been doing, particularly on the DFID FCO merger, which has been happening lately, which really quite a lot of you have been able to do that. Thank you very much indeed. Several of you have reported kind of getting party line responses, but it has been really useful to see them, and big thank you to everyone who's already shared their response from the MP and from the government. So the new Foreign, Commonwealth and Development Office, as it's going to be called, is due to start work in September, and so now is a really great time to have that public support for its work to continue to focus on reducing poverty, to be as effective as possible, and to be properly accountable to Parliament. So thank you. Like to flag the work of the Linlithgow group recently, who were persistent in pressing their MP Martin Day on the Global Fund's COVID response mechanism. He has shared a response which shows the government is supportive of the mechanism and are taking a leadership role in global health, as they said. That's a quote from them. And you know, we don't think, we've seen letters that say they aren't thinking of committing extra money at this stage, which we have asked, we think we do need, but we will be getting back to you if we need a further push on this and if there's an opportunity for further movement on that. Congratulations also to Fiona. I don't think she's on this call, from the London group, who has been able to get published in the South London press with a piece on the need for global solidarity during the COVID pandemic, which I am just going to paste into the chat box. Well done to her. Oh, I should say that anything on our Facebook group that gets posted into the chat box, it's a private Facebook group, so you need to have ask for access, and we'll give you that. Next, just like to ask if anyone from the Stort Valley would like to tell us about their meeting with the recent meeting with Julie Marson MP, because that sounded like it was really successful.
Maureen, you want to take this one? Or Jill?
Yeah, I'm just unmuting myself. Okay. Yeah, we three of us met. Two of us are Julie Marson's constituencies. But it was the first time that we'd actually managed to meet with her, and we had a double response. We talked about the COVID-19 response mechanism, and also about the merger of the FCO and DFID. So Corinne took that side of it, and I did the COVID-19 response mechanism, and it was a really good meeting, much better than I'd expected, if you know what I mean. We got 50 minutes with her, and she said that she was passionate about girls' education. That was her particular interest, and she really rates the Global Fund, and so we got lots of useful information. But one of the interesting things was that I'd managed to go along to the hustings, and I asked a question about whether they were proposing to merge DFID and the FCO, and she assured me that that wasn't on the cards when she was a candidate. And so when I'd finished my little spiel, she said, "Oh, I'd just like to say that I had no foreknowledge of this, but when I heard it, I thought, Jill's not going to like that." And that was from one meeting asking a question at the hustings. So it just goes to show that any opportunity is good to get the message across. I don't know if Corinne wants to add anything to that.
I was pleasantly surprised. She's a Tory in a safe seat, and it wouldn't be my politics. But I was genuinely surprised that her views, obviously, in many ways chimed with ours. And it felt like a really good time to have met with her, and for her to give us that much time to help educate her, in a sense, about the issues. And so, yeah, I'd encourage anybody to try for that meeting with the MP. And we were really privileged that they offered us either the Friday, the usual slot, or another day during the week where we could have more time. So we went for that, which got us the 55.0 minutes. So yeah, I'd really encourage people to have a go and try and build that relationship. I'm sure it's not always going to be easy, and I'm sure it's not always going to be plain sailing with her, but definitely worth doing.
Thanks both. And I've also just pasted some resources which the Stork Valley group made for that meeting in the chat box. Everything that appears in the chat box is going to be, the links all appear on the version that's published on our blog. So if you don't have the time to cut and paste that, that's fine. And I've just seen I've not in fact pasted it when I thought I had. So I also want to hear, hopefully we can hear from the Brighton group, who recently put on a successful local event as part of a festival. Elena, is that something you want to just very quickly fill us in on?
Yeah, so we had a local festival called the Covidarity Festival, in which a group of, I think they were former Sussex students, basically got together and said, okay, we want to bring people together in kind of arts, writing, video, to show solidarity through COVID. So they called it the Covidarity Festival. So, sorry, I got into contact with them and I said, okay, well, we have a Brighton group. How would you feel about us doing a talk, maybe about like global health, that sort of thing? And they said, yeah, if you could link it to Brighton locally as well, that'd be great. So we put together a video that was about 15 minutes long, and we discussed kind of our local advocacy and the Success with Gabby meetings with Caroline Lucas and Lloyd Russell Moyle. And at the end, I think we had about 15 people together. And at the end, we had like a really, really great discussion, about half an hour just discussing. There was like Q&A, and there was some members from other local groups, grassroots groups, who said they had a lot of questions about having meetings with MPs and stuff like that. So there's definitely potential from that in the future of making connections, maybe like doing workshops and talks together. So it was such a worthwhile thing to do, just to make those connections. But yeah, it was really great.
Amazing, thanks, Elena. I've just put a link to the Brighton event video in the chat box, but I cut it off, so I've just sent it again. There we go, we've got the correct video there. So I noticed our speaker has now joined us, so we're going to just go to her in a little while. But just before we do, I also wondered if Edinburgh, you wanted to talk about your recent meeting with new MP Christine Jardine. Is that? Hi, Kathy.
I'm not sure if Cameron or Natalie are on the call tonight. So I'll just say briefly.
I'm here too, Kathy.
Oh, Natalie's there. Oh, Natalie, you can discuss.
Oh, okay, sure. Hi, everyone. This was actually my first ever meeting with an MP, because I'm new to results. So I think personally it went very well. She listened to all the issues that we wanted to discuss with her. Kathy filled her in a bit about the Global Fund, and she seemed really responsive to it. So she has written to the Prime Minister, and she's also tabled a question with the Secretary for International Development. So yeah, we got quite a good outcome from that meeting. I don't know, Kathy, if you want to add anything else?
Thank you very much, Natalie. I've just put a link to your Facebook picture. Again, that's in our closed Facebook group. Just lastly, before we close up with news from around the UK, I just wanted to mention that our national conference is now live. Bookings are live. So again, that link to that is going to go into the chat box in a little while. If you haven't booked up, please do. And the link is also, it's been emailed to you recently, so you should have that. I think that was sent out on the 22nd of July. And if all of those routes fail, there's a link at the bottom of our homepage on the website. You can see it's a link called Events. So that's pretty much it for me. Thank you again for all of your contacting your MPs. And if any of them have written to the Secretary of State or Prime Minister and you haven't told us about it, we'd love to hear about that. So back over to Lucy.
Thank you very much, Naveed. Now on to the topic of tonight's call and to introduce an extra special guest. It's my great privilege to introduce Martha Nyagaya. I hope that I've got that correct, Martha. Martha is Nutrition International's country director in Kenya. In this role, she leads program planning and development at the country level and manages relations with the government of Kenya and other key stakeholders. I met her when we went on a delegation earlier this year and was so impressed by the work they were doing that I felt it would be really good for her to get, for you, all of you to get a chance to meet her. She also works in the region and globally to influence nutrition policy and helps to ensure that programs to improve nutrition are implemented together with other development interventions in a coordinated way. Martha has more than 15 years experience working in sub-Saharan Africa in a range of programs, including food security, nutrition, health, and HIV/AIDS. Prior to joining Nutrition International, she worked as a nutrition portfolio manager for the Children's Investment Fund Foundation and as a regional nutrition advisor for Irish Aid. Martha, many thanks for joining us on this call tonight. And I want to say a special thank you because I know it is very late in the evening in Kenya, and we are really grateful that you're giving up part of your evening to share your experiences. On the call, we have volunteer campaigners from around the UK, some with a lot of experience of advocacy on international development issues, and others who are brand new. Some of them been advocating on funding for nutrition programs for a long time, and others are very new to the issue. But everyone on the call this evening is key to do their bit to fight against global poverty, which is Result's mission. Now, we always have a few questions which we have shared with our speaker in advance, and we take these now. After that, we will open for the discussion for anyone who wants to ask a question. But before that, please could you just spend a minute or two introducing yourself, Martha, and telling us what it is that motivates you to help people get the nutrition they need.
Thank you very much, Lucy. And I thank Results UK for inviting me, and also Navid for the guidance that she's given me before this call, and Tom, who I met before COVID-19 pandemic in Kenya sometime early this year. So early this year, 2 members of parliament from the all-party parliamentary group for Nutrition for Growth, Lord Ray Collins and
Baroness Manzor.
Baroness Manson visited Kenya, and I was so inspired by their thoughts and insights about the work that we were doing. And also, I was very impressed that they were very grateful for the work and provided an opportunity for us to expand the advocacy space beyond Kenya and link with the UK champions. So it's a very great honor for me to participate and contribute to your efforts to campaign for prioritization of nutrition. And I do fully support efforts to mobilize additional resources for nutrition with you and back home here under the domestic resource mobilization portfolio that I lead also. Well, I find my inspiration in more things than I can count. In ordinary people, in the emerging women politicians in Kenya, in many women in my village, but most importantly, the strength of my parents who brought up 11 brilliant children with very meager resources in a village near Lake Victoria. I'm a mother of 3 boys who did not manage to exclusively breastfeed her children, despite all the knowledge I have in nutrition and the experience and the expertise. Every time I tried to express milk to breastfeed my child exclusively for 6 months, which is the optimal way of feeding an infant, I looked at the clock, I was running late, I was working for the Center for Disease Control and Prevention at that time, and I panicked and the milk disappeared. And I was so challenged, I realized how much support I needed, even being a nutritionist with knowledge of what should work and what is optimal nutrition. I also realized how much support other women who are less empowered with less opportunities like me would require to do such a basic thing as breastfeeding. And being a nutrition champion, currently I am working to support those women, and I realize that it is not just the knowledge that is important. It is the environment, it is a lot of psychosocial support, there's gender dimensions to it, there's the work environment, and therefore there's lots of things that will contribute to optimal nutrition for a child. I am a nutrition champion. I'm currently registering initial success in mobilizing resources at subnational level. And given devolution in Kenya and the fact that Kenya has moved to a middle income country, it is useful that we do this in a way that is sustainable and in a way that holds our own African leaders responsible and accountable for the commitments they make in global forums. And I'm now inspired by the global momentum, the advances that we have made, the Global Nutrition Report that shows that there is success and there's light at the end of the tunnel. But most importantly, the efforts and commitments being made at various levels by champions like you people and advocates coming up every day, and the broadened understanding of nutrition. So I am so motivated, and I am very honored to participate in this forum today.
Many thanks, Martha, for sharing a bit of your personal motivation for the fight against malnutrition. We do like to hear what it is that drives people to do their work in international development. Now we'll take the usual pre-arranged questions before we open up the floor for anyone who prefers to text in a question. The number for texts tonight, it is different to the voting number. It's 07411 752 413. That's 07411 752 413. Please note that's not the same number we gave you for voting. You can also put your questions in the chat. So now for the first question this evening, which should be from Birmingham, hopefully.
Hello, Caroline Hurd from Birmingham. Welcome, Martha.
Okay. Thank you, Caroline.
Okay, right. I'm going to tell you the first question. Can you explain how nutrition programs work together with other poverty reduction programs?
Well, causes of malnutrition are complex and they're interrelated and they can take years to overcome. But let's just start with a few basic statistics. From the Global Nutrition Report, poor nutrition underpins nearly half of all child deaths in the world, and an estimated 144 million children under the age of 5 are stunted. They are not just too short for their age, but they are also subsequently cognitively impaired, affecting their ability to learn and to grow properly. We also know that child obesity and overweight is increasing at an alarming rate. And Kenya and the UK is one of the many countries in the world where all forms of malnutrition exist. You find a stunted child with an obese mother in the same household. Almost 3 million child deaths could have been prevented through improved nutrition alone. But the COVID-19 pandemic is increasing food security and hunger and making efforts to prevent and treat malnutrition more important now than ever. So in my participation today, I would like to just provide a quick overview of what these causes of malnutrition are and how the various interventions are being integrated on ground to address this problem in a multi-sectoral nature. On the one hand, we have disease that is driving undernutrition. We see very, very thin people with HIV. We see diarrhea in children, increasing undernutrition in children. And we see recurrent diseases such as malaria causing anemia in girls, women, and children. So the immediate cause of undernutrition is disease. But another immediate cause of undernutrition is inadequate dietary intake. In most of sub-Saharan Africa, our immediate need is to fill our stomachs. We want to be satisfied, and people don't care about the different nutrients that are required. Because when you get prolonged inadequate intake of certain foods, you don't immediately feel sick. You get stunted and you get cognitively impaired. But we look at our most immediate food needs to fill our stomach, and that leads to a focus on consumption of staples. But below the disease and inadequate dietary intake, an inadequate dietary intake is a fundamental cause of malnutrition, because if you find an obese mother and a stunted child in the same household, it means the driver is poor dietary intake. We focus on consumption of staples, so the mother is eating too much of it, but it's too big for the child to eat to get their adequate nutrients, and therefore you end up with an undernourished child and an obese mother. But what drives inadequate dietary intake is really poor household food security, which is an underlying cause of malnutrition, and also inadequate care for that child. And when that child gets sick, then there's unhealthy environment and poor access to health. So at the top, the immediate causes of malnutrition are dietary intake and disease, but the underlying causes include the health of the environment, inadequate care from the mother, who sometimes works in the informal sector and leaves the child under the care of other children, and also household food security associated with either on production and purchase. If it's associated with own production, then there's the gender dimensions of it, where women have no access to learn to produce enough food, or they need permission from their husbands, or they're not empowered enough to decide what is being produced at household level. But the gender dimension of it is also associated with the power of the woman at the household level, who is responsible for food, to decide what to purchase for the household members. And so there's income poverty, there's employment issues, and there are so many other underlying issues, including poverty, lack of capital, access to income, access to the power to make decisions. And so all these issues are interrelated and interdependent, and automatically leads to undernutrition. That is what underpins the fact that we need a multi-sectoral approach where all these issues are addressed. So we need the education sector, we need the health sector, we need water and sanitation sector, we need the agriculture sector, not to produce just staples. We also need extension workers, we need community development, and we also need social protection to protect communities from the shocks. So food access does not automatically translate to good nutrition. The terms food and nutrition security, these terms are used interchangeably when talking about the coming of malnutrition crisis and hunger. And we know they are linked, but different concepts that yield different outcomes. So the lack of this distinction between these concepts is causing key donors, including the UK government, to prioritize food security interventions in their COVID-19 response plans without fully understanding the threat of malnutrition and the fact that we need a multi-sectoral approach. And we need to understand, how do we use the existing health platform to address nutrition issues? How do we load nutrition messages in an immunization program? How do we use immunization to provide vitamin A? How do we use antenatal clinics to provide iron and folic acid and nutrition messages for mothers? In the agriculture sector, for example, how do we use extension workers distributing manure and improved crop varieties to also pass nutrition messages? How do we ensure social protection programs have gender considerations? And how do we address the girl child through the education system when they are still young, to get empowered with knowledge that they need to be better mothers in future using the school platform? So nutrition and food security approaches are complementary. All the sectors need clear guidance on what nutrition considerations they should be taking in place. And food security focuses on increasing availability, access, and affordability to food at the household level. But nutrition security should focus on nutrition needs of an individual and how their diet, gender, health, and all these sectors can work together to address nutrition. And my last point on this is that we must intervene, but not just intervene at the right time. And there are two windows of opportunity. The first window is from pregnancy to 2 years of age, and the second window is the adolescent period. So nutrition programs will often focus on pregnant and lactating women, children under 5 years, the adolescent girls, because they have heightened and time-sensitive nutrition needs, that if we do not address them during that critical window, then the damage is irreparable. So we must approach this in a multi-sectoral way, and we must ensure that nutrition considerations have to be met to shape diet choices and quality, and to empower the women, and also to address the food environment and production, as well as food storage and transformation systems that would lead to either consumption of too much salt or too much sugar or over-processed foods. And so it is very important to blend this. And the GNR report says it very well.
Sorry, Martha.
We've just had a couple of questions in the text box, a clarification. Did you say extension workers, and are they community outreach workers? What is an extension worker?
Oh, I'm sorry. An extension worker is a community agriculture support worker. So we have health extension workers. In the agriculture sector, we call them agriculture extension workers.
Thank you.
Martha, we now have a question from Oxford. I think you might have answered quite a bit of it, but just if you've got anything extra to add.
Yes, thank you, Martha, for all your responses so far. Next question is, we've seen warnings of the COVID-19 pandemic making hunger and malnutrition worse. Are you seeing this currently, and what exactly is happening around the world?
Yes, actually, that's, I think, the second question that Lucy was going to ask me.
Yeah, so Oxford, it's, yeah.
So, Lucy, do I proceed to answer that, or I wait?
Yes, definitely.
Okay. So, there are many ways in which COVID-19 is increasing hunger. And we know that a few examples of, we have not yet discerned impact on how this is affecting specific programs. But we have done some rapid assessments that are indicating danger signs. For example, we have less visits for routine nutrition services. Children are not getting vaccinated. The vitamin A campaigns cannot be conducted in the context. Women are afraid of attending routine antenatal clinics for their iron supplementation. And there is also generally limited attention to pregnant mothers and delivery services because the focus is so much on COVID-19. So there's also a bit of reprogramming of resources to address the COVID-19 related needs and stockouts for very essential commodities for nutrition, such as iron and folic acid tablets, vitamin A supplements. And the platform that is used for group counseling sessions for women is currently closed. A number of other platforms through which interventions are delivered are shut, such as schools, early childhood education centers, and we are seeing increased adolescent pregnancies. For example, in some of the counties in Kenya, adolescent pregnancies have increased up to 50% between March and now. And given the limited community engagement and the community platforms that we use for education, the mother-to-mother support groups, the father-to-father support groups, we are expecting a drop in delivery of essential nutrition services, and this may erode the gains that we have made in the past decade. So yes, you are very right. COVID-19 is producing a malnutrition and hunger crisis, and the spread of COVID-19 has triggered an economic crisis touching nearly every corner of the world. The global economic shutdowns and disrupted supply chains have devastated incomes. In the informal sector in most of sub-Saharan Africa is currently almost completely closed. People who live by daily income cannot afford basic food products and cannot even afford a meal. And in turn, they have reduced purchasing power, which has further limited access to nutritious foods for millions of people, particularly in urban areas. You know, our health systems are built to treat sick people rather than prevent diseases. And so we will find doctors sitting in health facilities and waiting for sick people to come. We are trying to advocate for a more preventive approach to healthcare using our universal healthcare framework. And we know that governments have diverted limited health and nutrition resources to treating immediate medical needs to the detriment of essential routine care. So combined, these factors have created a malnutrition crisis, and we think will create a huge hunger crisis. So it's a health crisis leading to an economic crisis, leading to a service delivery crisis, and then linking to a livelihood crisis, and then a diet quality crisis that will lead to a hunger and malnutrition crisis. So our key message as champions is that a crisis is coming, a malnutrition crisis is coming, and its impacts, if left unchecked, could compromise millions of the most vulnerable people in the world and erode the gains that we have made over the past decade. And malnutrition could even prove to be even more damaging than the COVID-19 itself. So we need to take nutrition as seriously as a direct COVID-19 response measure if we want to protect the most vulnerable populations. We say that nutrition can't wait. Investments in nutrition are important now and will become critical in the medium term. Sorry, Lucy.
No, that leads us on to the next question, from which is the third question we told you about, from Sheffield.
Hi, Martha.
Hi, Sheffield.
What is the importance of the Nutrition for Growth agenda for funding programs right now?
I think the Nutrition for Growth agenda is more important now than it was important before the COVID-19 pandemic. And I have mentioned that the pandemic is risking essential services and many key nutrition interventions just can't wait. And good nutrition is critical for immunity, resilience building, and all the things that I've mentioned in the interrelated response. But within the N4G campaign, I think we still need to take into consideration three things. What is our
Seems to have frozen. Oh, hopefully she's
immediate response? What is our resilience bound recovery? Hello?
Yes, we lost you there, but carry on.
Can you hear me?
Yes, we can.
So I was talking about the three critical things that N4G needs to take into consideration in the COVID context. What are the considerations we can make in our immediate response, like in support for nutrition services? What is our resilience building response plan? And what is our recovery response plan for COVID-19 that then would impact on the importance of Nutrition for Growth agenda for funding programs right now in the context of COVID-19? The recent DFID FCO merger and the proposed budget cuts pose a real threat to the UK's leadership in nutrition. And we know that the UK has played a critical role in global nutrition as a leading investor, as a thought leader, and also as a convener at the global level. For example, in 2013, the UK created Nutrition for Growth as a global momentum to mobilize both political and financial commitments. The UK has also brought a critical focus to low-cost, high-impact basic nutrition interventions, such as the breastfeeding one that I mentioned, for women and for young children at the center. But the UK's 2013 N4G commitments end in 2020, that is this year, and now a full year before the next N4G summit, with over 2 billion malnourished people around the globe, even before COVID-19, and COVID-19 increasing the vulnerability and susceptibility of millions to this disease. Ongoing nutrition funding and leadership from the UK in 2020 is critical. And an early pledge to N4G in 2020 would be one excellent opportunity for the UK to support. And also not just to support nutrition investments, but also to support COVID-19 response and recovery and sustain the UK's reputation and gains made in the past as a nutrition leader, but also support signaling to other governments and donors that nutrition is a core component of an effective COVID-19 response. And the N4G agenda more broadly is incredibly important as COVID-19 cases continue to rise, as governments weigh where to allocate scarce resources, and global donors consider how to support response and recovery efforts. So we have been working with advocates like Results UK to ensure we put a spotlight on nutrition in 2020, and in the lead up to the N4G summit, mobilize grassroots commitments. But the UK government needs to hear from advocates like you champions that nutrition is critical, but also from grassroots people like us to mobilize the commitments required ahead of N4G. So we need impact commitments, we need financial commitments, but we also need political commitments to hold African governments accountable. beyond just endorsing policies and programs, and also program commitments at grassroots level, focusing on the implementation of concrete strategies to achieve nutrition as identified under each of the country plans.
Thank you for those very comprehensive answers, Martha. We've just got about 5 or 6 minutes left in which we could ask other questions. So I'll now open the floor to anyone who would like to ask a question. If you could introduce yourself and say where you're speaking from, just unmute yourself and ask Martha your question. If you don't want to ask it yourself, you could put it in the chat box, and I'm very happy to ask. So does anyone have a question they'd like to ask? Is that...
Hello, I've got a question because last year I went to South Africa and Lesotho, and we activated 200 Wonder Bags, which helped empower women in their villages and cook nutritious meals. And I just wondered, do the women have Wonder Bags in the villages in Kenya?
I don't know what Wonder Bags are.
All right, okay, maybe you don't then. What they do is, so you cook the sort of part for 5 minutes, and then you put it in a Wonder Bag, and it's thermal cooks for 20 minutes, so it stops women having to cut the wood down and carry on lots of water. And I just wondered if you had them to aid nutrition in Kenya.
Yes, we do. We call them energy saving jikos.
Oh. Okay.
Yeah, and it's really helped with deforestation, but also saving women's time and whatnot.
Mm-hmm. Thank you.
Are there any more questions?
I just had one myself, actually, which is it's a bit of a climate change question, actually, in terms of how you see that having a major impact on food security and malnutrition in the future. I mean, I know obviously COVID-19's had a major sort of impact on the immediate short term, and will have a significant long-term impact as well. But sort of, is there like, how do you see the future horizons in this area being affected by that?
I think there's already quite some evidence about the effects of climate change on food security and nutrition, the limited sources of water. The climate has also affected food production generally, having communities with less foods, focus on staples. So there are few interventions that are currently being explored, and the agriculture sector has worked on some labor-saving technologies that support women who farm, but also drought-resistant crop varieties, as well as nutrient-rich staple crops, because predominantly people consume staple foods. So if we eat potato, then we eat vitamin A-rich potato, or the yellow maize, or the iron-rich beans. And so there's lots of efforts to address the effects of climate change through breeding drought-resistant varieties, and also afforestation included. And there are other initiatives to address climate change, such as the Adopt a Tree movement for every school child, so that every child can grow a tree, and the energy saving jikos that Rebecca mentioned, so that we can reduce deforestation and have forest cover to improve the environment. I am not a climate expert, but yeah, no. I know that there's things that are going on around the linking climate change and nutrition.
Yeah, thank you.
Just got a couple of more minutes if anyone else wants to ask a question.
I've got a question, if I may.
Yeah, go ahead.
Hi there, Cameron from Manchester here. Thanks for talking to us, Martha. My question was about you mentioned a couple of times holding the government to account, or specifically holding the Kenyan government to account on a number of things. And I wanted to know if, firstly, I guess, how difficult is that? And then, and how far up the list of priorities for the government is, nutrition and nutrition security? And then also, at let's say the top level of government, are they on board with this multi-sectoral approach which you're advocating for? Or do you find that you have to go further down the devolved in administrations to actually achieve that joined up approach? Sorry, there's probably 3 questions in there. Apologise.
Thanks, Cameron. On holding the government accountable, that's challenging, but we are getting there. So we have in the past had most of our, not just Kenya, but African governments come to global forums, endorse policies, endorse targets, but nobody back home translates that into what it means at national or subnational level, strategically and analytically. So being the chair of the Global Sun Movement CSO network, we are taking part of that responsibility. If Kenya signs up for N4G or SDG targets or World Health Assembly targets, what does that mean at the national level? Can we engage with parliamentarians to ensure they understand what that means? And we have started a number of surveys for naming and shaming and for comparing counties. And devolution has worked so well for us because health is one of the sectors that are fully devolved in Kenya. And so working with county governments is much easier because you're working with a smaller grassroots level politician who would like to campaign again and get there again. And so the naming and shaming has really helped to hold them accountable for the commitments that they make. We are exploring other ways like conducting rapid assessments and holding coordination meetings at national level where we share the ranking of counties on different targets they committed to. So it's not easy. It has helped a lot, sharing findings with counties and naming and shaming those who are not performing well. On the multi-sectoral approach, I think one of our main needs that has been actually supported by the UK government is supporting subnational level governments with planning in a multi-sectoral way. And devolution is an opportunity for us to implement truly multi-sectoral approaches, not just to nutrition, but to health and to climate also. And so if we support counties with guidance on what considerations each sector needs to make and have a solid legal backup for that in a policy document at subnational level that we share with parliamentarians at subnational level and they endorse, then it's very easy to continue with that plan and those commitments, even if political leadership changes. And there's also lots of informal dialogue forums, and I can come back to you with more details, Cameron. I know we're running out of time.
Thank you very much, Martha. I'm afraid we've run out of time to ask a couple of questions that have come in on the chat. So I'm sorry about that, Jill and Peter, but hopefully we can come back to those another time. Now, before we finish the call, I'd like to ask Naveed to announce the result of the ballot.
Yes, thank you, Lucy. So having counted the votes from both the online and text voting, the result is, drum roll, Richard 2 votes, Cameron 27 votes. So congratulations to Cameron. I think Richard's endorsement might have played a part in that result.
I think so.
Whatever the reasons for that, very well done. A current member of the Board of Trustees will be in touch with you very soon to arrange an induction and tell you about their next meeting. I see Jamie, one of the co-chairs of the board, on the call. I don't know if it'll be him or not, but I'd also like to thank both of you, Richard and Cameron, for putting yourselves forward. So thank you ever so much. And I'm now back to Lucy to round up the call.
Okay, so we've come to the end of our time together this evening. I'd like to say a really big thank you to Martha for sharing her expert knowledge of how nutrition programs actually work on the ground and what is needed to make them effective. I'm sure you'll agree with me that Martha has shown very clearly why nutrition programs are so important and why we need the UK government, along with other governments and institutions around the world, to continue to support them. I want to end this evening's call by thanking all of you for your continued action, which, though it is harder than normal to get the attention of politicians because of COVID, it has never been more important to make sure they keep up the pressure on international development issues, including nutrition. So if you are able to take this month's action, thank you. As always, do share any responses you receive with Naveed and Ordella. Finally, the next Grassroots conference call will be on Tuesday, the 1st of September. Good night from me, and I hope you enjoy the rest of your evenings. And thank you all very much for joining us.
Thank you.
Thank
you.
Thank you very much.
Thank you,
Okay.
Martha.
Thank you.
Thank you. Bye-bye.
Bye.
Bye-bye.
50 people on the call.
Brilliant.
Amazing.